Hi everyone, let's talk about Chapter 2 in your health insurance class. This has a lot of really good terms for you so that you understand health insurance. For example, preventative services. Preventative services are actually mostly covered by most insurances. This includes things like vaccines, your OB, GYN, not OB, excuse me, just the GYN exams, things like that. They're usually covered at 100% with most insurances. Excuse me. So, what is health insurance? And the health insurance you have to remember is a contract between the policyholder, and then the policyholder is who signs the contract, who has the insurance, and the insurance company. So, even though hospitals and all file your claims for you, when it comes down to it, if your insurance doesn't pay, and usually the hospital will step in to help try to get that resolved, but ultimately the contract is between you and the insurance company. So that can be a little bit interesting there. A third-party payer is someone who we bill to for the insurance. For example, Blue Cross Blue Shield would be a third-party payer. They are definitely the ones who provide coverage, shall we say. Let's see what else you want to know here. So 67% of people are covered with health insurance. I'm not sure that statistic is up to date right now because of COVID. A lot of people lost their insurance with losing their jobs, and there were a lot of lost jobs with this. So this is before COVID, so you need to remember that, okay? The most of them are 67% are from private health insurance, 19% by Medicaid, 17% Medicare, and then almost 5% is by military healthcare or CHAMPUS. And in this book here, we're going to go this semester. We'll go through all the different types of insurance, and they'll separate them out to different chapters for you. Makes it a lot easier for you to learn, okay? Group health insurance is what is covered by your employer. And it is, they usually pay a good portion of it for you. Individual is private health insurance that you would actually go out there and get for yourself. Public is Medicare, Medicaid, CHAMPUS, that type of thing. There's a lot of background information on insurance for you. Obamacare is still out there right now, the health market where you can purchase insurance, and some of it's subsidized, some of it is not. It just depends. The policies are, there's a wide variety of them. So if the health insurance market is what you are looking to purchase your insurance, read it carefully. There's a lot of information on there. Documentation, as I said before, if it wasn't written, it wasn't done. And also, if something was not done, you have to document that also. So you have to make sure that you read the documentation carefully. A patient record or a medical record is where everything is located for the patient. Right now they're electronic, so it's usually an EHR, electronic health record. And a lot of places, their records are kept in such a centralized means that other providers can access it. So, like where I go to my doctor, any of my doctors and the hospital can all see my records, and they can share that information. Makes it much easier. A problem-oriented record is, instead of going by each time you come in, it's an order of. So it's an order of what is going on with you. If you have a major issue like diabetes or something like that, then it's going to go by the order of what the problem was you came in for, what's your chief complaint, that type of information. EHR, we just talked about those. Lots of information on EHR. Quality measures are very important to hospitals and doctors' offices, so make sure you read this area very carefully. Has a lot of good information in there. Oh, that's a short chapter. Okay. So that's it for chapter 2, and let me know if you have any questions about that. Oh, also before I go any further, you're going to be doing some practices with a piece of software here. I'm going to post some videos on how to do that. Make sure you watch those and get through it. After you've completed the first one, if you're still having difficulties, get in contact with me. You only have 3 attempts on these, and it's very important that you follow how to do them, or you're going to make really low grades if you don't, and I don't want you doing that. It's not a difficult thing to do. It's actually fairly easy step by step, but if you don't understand what they're asking for, and that's usually the problem with this, you can't tell exactly what they're wanting. So watch that video so you know how to complete those practices. Thanks, and let me know if you have questions.